Meaningful Use Stage 2, Course Set 17, Secure Electronic Messaging. The requirements of Course Set 17 are for the medical practice or the eligible provider to use secure electronic messaging to communicate with patients regarding relevant health information. The measure of this is that a secure message was sent using this electronic messaging function of the certified electronic health record technology by more than 5% of unique patients or their authorized representatives seen by the provider during the reporting period. Now, at the end of the reporting period for attestation, this will result in a numerical count of unique patients, meaning a denominator and a numerator. The denominator will be all unique patients seen by the eligible provider during the reporting period. The numerator will be the number of patients within that denominator who have actually sent an electronic message securely from the patient portal to the eligible provider within the EMR, and this number must exceed 5%. Now, please note it is not required that the provider actually respond back to the patient's message. But if you notice again, the requirement is for the patient to send a message to the doctor. So unlike all of the other measures of meaningful use that we have discussed in different training videos, Measure 17 puts the responsibility on the patient. So this will require you in the practice to do some education with your patient population. Now, it is only a 5% requirement. So for those of you who are concerned that some of your patients may not be PC savvy, you would have to, of course, use your discretion as to which patients you encourage to use this feature. The only way to exclude yourself, however, the only way that you can exempt yourself from Course Set 17 is if you have no office visits during the reporting period, or second, if more than 50% of your encounters are geographically done in a county that does not have a broadband service in more than 50% of the housing units within that geographical location on the first day of your reporting period. So those of you in a heavily rural area, for instance, if there is a lack of broadband connectivity to 50% of the homes in your area where you treat your patients, you can declare an exemption on this measure. Now, since this is on the responsibility of the patient, this involves the patient portal. So I'm going to log in here to the portal as my patient, Olivia Pope, and we will generate a message to her physician. Now, as the patient logs into the portal, you'll want to look across the top here and go into the message center. So as far as educating your patient population, this is what you will need to do so that your patients understand how to help you comply with Measure 17. So once they go to the message center, on the left-hand margin here, we see the options after inbox and sent messages to compose. So this is where the patient will come to compose a message to the physician. Now, as far as the content of the email, there are no guidelines. So the patient can send you any kind of an email that's relevant. The subject is mandatory. They do not need to type in an additional message, but if they don't, then the subject will copy automatically into the message. But the real thrust of what's important for you to understand is in the address to list. Now, in my patient portal, I am showing all of the physicians in my practice as well as my support person. This is controlled by a property that must be defined at the configuration level for the entire system. The three options are to have this list only give you a patient support person, only the patient's primary physician as defined on the patient register screen, or as in this example, all of the physicians in the practice. It's important to note that only the doctor to whom the patient addresses the message gets the credit on their meaningful use dashboard. So for instance, this was defaulting to Dr. Butler because alphabetically that's the first one in the drop-down list of doctors, and because the system property is set to display all available doctors. Now, if you set the property to the primary doctor only, since Olivia's doctor is primarily Sheldon Cooper, it would have defaulted to Sheldon, and in the drop-down there would be no other choices. The person who gets the message from the patient is the one who gets the credit for meaningful use. So if we go in here to Olivia's patient register, we see at the top her primary provider is Sheldon Cooper. So when that property is set accordingly, this would be the only one available. The important thing to note, though, is this email goes to the physician inside the EMR. So I'm going to go ahead and send this as the patient. And now I am going to log in as Dr. Cooper so that we can see what the doctor sees when this secured messaging comes into his inbox. So I'm just going to go in here to Dr. Cooper's mailbox, and there it is, from Olivia Pope, subject status of my lab. So to view the message, of course, Dr. Cooper just clicks on the link, and then he can do what needs to be done. Now, it can also be the patient's authorized user. So back on the patient's portal, I'm going to open the personal info tab. Over here on the left, we have an option called Authorized Users. Now, although this does not show up in prognosis, if the patient has identified an authorized user here on the portal, they also will be given an ID and password, and they will then be able to send the message to the doctor, and it will count as MU credit, same as if it were the patient.